Hello, my name's Nuala Lucas and I'm an anaesthesiologist working in the UK. My remit today is to talk to you briefly about obstetric anaesthesia. We all work in very different environments across the globe, but we all share one common goal, and that's to ensure the safety, comfort and dignity of our patients and, of course, look after their babies. So over the next few minutes, I'm going to talk to you about 3 areas that I hope will be useful to you in your practice, regardless of where you work. The first thing I want to discuss is the role of epidural analgesia in maternal safety. And I want to draw your attention to this great manuscript published last year in the BMJ with an accompanying editorial. This group looked at more than 500,000 women and the cohort within which you had epidurals and compared their outcomes with women who didn't have epidurals. And what they demonstrated was that having an epidural in labour conferred a roughly 35% risk reduction for severe maternal morbidity. And if you added critical care admission onto severe maternal morbidity, the risk reduction was even greater. Now, why should this be? Why should having an epidural confer this benefit? There are a variety of mechanisms that I've outlined here. But I think the one aspect that I think has the most biological plausibility is the increased medical care and attention associated with epidural analgesia, enabling us to detect complications and problems and address these complications and problems more rapidly because of the care that these women are getting. But regardless of the mechanism, the first take-home message for us all is that increasing access to neuraxial labour analgesia for vaginal delivery may improve maternal health outcomes. The next thing I want to tell you about is a tool to help improve the management of emergencies. Now, we know that checklists and cognitive aids have a valuable role when we're managing emergency situations. And this recently developed app by the OAA in the UK is freely available to all. It's an app based on the quick reference guide to the management of obstetric emergencies. You can download the app from the App Store and there's an Android version available. And I've just put up some screenshots here of what you get when you access the app to help you. So I'd urge you all to consider using it so that if you find yourself in the difficult position of managing an emergency, you don't have to try and dig out guidelines from the intranet or even use paper-based guidelines. You'll have this app with everything you need to do instantly available on your phone. The third thing I want to talk to you about is reducing unwarranted variation in obstetric regional anaesthesia. Now, we all value our clinical autonomy, but when evidence-based guidelines are available, they can provide us with a valuable framework to ensure consistency and the best possible outcomes for our patients. And I really want to draw your attention to 3 guidelines that have been fairly recently published. The first relates to the management of post-dural puncture headache. It's a multi-society guideline. And while it doesn't specifically describe the management for the obstetric patient, the principles are fundamentally the same and you can use them in your obstetric patient. The next guideline I want to draw your attention to is a recently published guideline from the OAA about using intrathecal catheters for labour analgesia. This is a problem that we do come across from time to time. You've got an inadvertent dural puncture. Should you site a catheter and use it as an intrathecal or a spinal catheter, or should you re-site the epidural at a different space? And this guidance is really the first evidence-based guidelines to support practice in this area. The third guideline I want to draw your attention to, there's 2 guidelines, in fact, one from France, one from the UK, about preventing and managing pain during caesarean section under spinal or epidural analgesia. We know this is a problem area for practice across the world, and I really commend both of these guidelines to you to provide they provide a great framework to support practice in this area. Just before I finish, I want to give you a bit of food for thought about the role of the anaesthesiologist as part of the labour ward team. I think we're all pretty familiar with the evolution of anaesthesia as perioperative care, and certainly many of us take on much greater responsibilities beyond the delivery of analgesia and anaesthesia at the time of surgery. And I wonder if it's time that we brought some of these principles into play on the labour ward. I've suggested some potential areas here that we might consider undertaking. And for me, the one thing that I always think is really valuable is getting involved during pregnancy with the care of high-risk women, seeing them in clinic, contributing towards plans for delivery, anaesthesia and analgesia. Regional anaesthesia has revolutionised obstetric care, so let's continue this work, whether it's through research, education or advocacy. Let's ensure that every woman has access to safe, effective anaesthesia. Thanks for listening and enjoy the day.